Hi. Hello. Welcome to my Thursday night live. And tonight I'm going to be talking about hyperpigmentation. So I've just gone through, try and invite a few people in. Hi there. Hi Janine. So I'm going to be discussing hyperpigmentation, what that is, what does it mean, hi Casey, and ways in which it can be treated as well. So just to get started, again, if you've got any questions, pop them in the comments. Hopefully I will either answer them as I go through, or I'll come back through and have a look at all the questions afterwards and just answer any questions that you've got. So just pop them in the comments for me. Okay, so what is hyperpigmentation? So generally speaking, there are two types of skin colour changes. So we think about hyperpigmentation is essentially when your pigment, the colour in your skin changes to that of which is normal for you. So there are two types that we kind of talk about. There's hyperpigmentation and hypopigmentation. So hypopigmentation is where areas of your skin is lighter than your normal skin tone. So when you get those strange, unusual white patches of skin, that is the hypopigmentation, okay? So hyperpigmentation, which is what we're going to be talking about tonight, is the areas of skin that change to a darker colour than your usual skin type. So things like, for example, the age spots that we get. So just as we age, sun damage over the years, that kind of thing. And you get these strange little age spots, those little brown spots across your skin, that is hyperpigmentation. Same with freckles, is actually a form of hyperpigmentation because it is an indication of sun damage to your skin. Additionally, there's also things like something called melasma. Now melasma is more commonly seen in sort of larger patches as opposed to spots. It's in larger patches of darker skin colour that it changes to, and is often associated with hormonal changes. So people potentially on oral contraception might see changes in melasma developing, and it's very often known in pregnancy as well. So it's often associated to be something that develops either during or after pregnancy, and it is kind of nicknamed the pregnancy mask, because it can very often, quite traditionally, cover the whole sort of region across, you know, the bridge of your nose and around your cheeks, and very often across the forehead as well. Very often it comes out in almost like a butterfly type pattern. So you get the patches that come across the forehead, and then right across the nose and around the cheeks. And that, like I say, is sort of nicknamed as the pregnancy mask. So that's why melasma itself is very often associated with women in their pregnancy or post-pregnancy as well. And then another type of hyperpigmentation is post-inflammatory hyperpigmentation, PIH for in short. And that occurs after the skin has received some form of trauma. So it very often, if you have a think about any time where you've had a big nasty spot, and you know your spot's healed, so actually your skin's now covered and it's gone over, but you've still got an area of colour change. It might be a bit red, it might be a bit purpley, a bit pinky kind of colour, but the colour changes, and actually that is post-inflammatory type lesion, and the colour change associated with some sort of trauma or scarring. So you notice the change in the colour of your skin if you were to have a cut and then scar, is actually a post-inflammatory hyperpigmentation. So those are the three kind of main, that's what pigmentation changes are, and the three main types that we're going to talk about. And like I say, so the causes really, as I've said, we've got the sun damage. I mean, sun damage, as we know, I've talked about it before, I know, is, at 90% responsible for signs of aging in our skin. So we really, really need to be protecting ourselves from the sun. But along with that, it is also highly responsible for the other complicating factors that come with our skin problems. So yeah, and because things like skin cancers and things, the UV, the sun rays, UVA, UVB rays are highly responsible for the damages that come along with certain types of skin cancers and things like that. And when we think about getting a bit of sun, and people talk about having a healthy glow from a suntan, is scientifically is actually the absolute opposite. It's not a healthy thing to have a tan, because what actually happens is we've got the cells that are responsible for pigment in our skin, and what happens when the sunlight comes through our skin, what is actually happening is the sun rays are penetrating through the skin and mutating DNA cells that it triggers, that it reaches. So the sun reaches the DNA cells, and in order to try and protect those DNA cells from being damaged by the sun, these little pigment producing cells start chucking out a whole load of pigment. So that's your melanin that is chucking it all out to try and create a form of a barrier between your DNA cells and the surface of your skin, where the sunlight is coming through to damage it. So actually the tan isn't a nice healthy glow, it is your skin's natural defense mechanism to try and protect your DNA cells from being completely damaged by the sun. And as those pigment cells are then throwing out all of that pigment out into the skin, that's where you're starting to see that come through to the surface. So you're starting to see those age spots, those freckles, those that melasma, as it's all getting worse. So actually the sunshine, as lovely as it is hugely responsible for a lot of that kind of pigment damage that's going on. And I've already mentioned, as I say, in terms of the trauma, so that is as it sounds, really, anything that damaged the skin. So again, another reason really why we shouldn't be squeezing spots or picking scabs, because your skin needs to be able to heal naturally, and by squeezing and picking and things like that, it is only sort of like damaging those areas, and that's where the inflammation is coming and the colour changes to the pigment there. And like I've already mentioned as well, with hormonal changes, so that's another main cause really, is hormone changes in pregnancy, in taking the pill, things like that really, anything that people might be going through in terms of quite significant hormonal changes, that's where we're going to be noticing some of the changes in the skin tones. So on to treatment and what we can do about it. So when treating hyperpigmentation, it's important to know which type of hyperpigmentation you've actually got. And it comes down to trying to decipher what has happened to your skin. When did you notice the colour changes happening, the pigmentation developing? And it might be something where you can quite clearly say, you know, I only got this, you know, this colour change post-pregnancy, or during pregnancy or whatever, and you can quite easily pinpoint it sometimes. So it's kind of like looking back, thinking, when did you notice it? What did you notice first? How has it developed? Do you know, do you notice it any more at different times of day or year or anything like that? And going through that with someone like me to really understand the type of hyperpigmentation that you may have, and that can then guide and inform us on how we can treat it. Because we need to think as well, you know, somebody like me would be having a look at your skin as well, and having a look about the depth of the change there, the colour change, and about whether or not that is in the more superficial layers of the skin, or whether it's further down onto the dermis and slightly deeper, in which case that's then more difficult to treat, and may take a longer period of time. But there are three main things that we need to do in order to treat it. We need to suppress the actual pigment producing cells. So the melanocytes, we need to actually suppress that and slow that down from actually creating more pigment, and lighten the existing pigment in the skin as well. So we need to use targeted ingredients and in serums and things like that, specific type of ingredients. So things like kojic acid, arbutin. There is also for quite significant hyperpigmentation, we'd be looking at something like a prescription only medication called hydroquinone, which you can't buy that on the shelves in the supermarket, or from your local beautician, because it is a prescription drug, but highly effective. So kojic acid, arbutin, hydroquinone, all those sorts of things, to actually be targeting the active pigment in your skin and the existing pigment, to lighten it, suppress the melanocytes from actually producing any more. Then we need to be looking at things like that exfoliate the skin. So what we need to do is stimulate new skin growth from the deeper layers of the skin, and get rid of the damaged hyperpigmented skin towards the surface. So this is where sort of like chemical exfoliation comes in. So chemical peels, things like lactic acid, glycolic acid, retinoic acid, and again, we can go even stronger according to prescription only, from a medical professional, with a drug called tretinoin, which is a very potent form of to stimulate cell turnover. So we're actually then producing new skin cells underneath, getting rid of what's on top, sloughing all of that off. So exfoliation is a really key factor in managing hyperpigmentation. And then of course, doing all that hard work to get rid of the existing damage, prevent more damage, and treat the actual pigmenting cells. We need to be protecting the skin. So the kind of the third key ingredient to treating it is sun protection. So you really must be wearing an SPF, preferably a physical sunscreen, and physical sunscreen is where the rays from the sun simply deflect from the surface of the skin, so they don't even get to penetrate the skin at all. A chemical sunscreen will allow the UVA, UVB rays to actually penetrate into the skin and then disperse that UV radiation through heat. But a physical sunscreen will actually prevent it from even getting in there at all. So like I say, we've got to protect the work that we're doing. With some pigmentation changes are easier to treat than others. Like I say, if they are more surface based, it's, you know, a slightly easier thing to treat. Some deep set melasma is quite a tricky thing to treat. Can take quite a bit of time. Depending on how aggressively you treat it as well. If you're treating it with non-prescription products, that's absolutely fine, and there are lots that are very, very effective. They just may take longer to get the desired result. If you treat it quite aggressively and quite then you get a much quicker result as well. But that doesn't come without its own side effects as well. But that's something that we would have to discuss if we figured that actually aggressive prescriptive treatment would be appropriate for you. So I've talked about treatment serums. So as I've mentioned, the kojic acid, arbutin, white shiitake mushroom and hydroquinone, they're all tyrosinase inhibitors. And that's what we need to do, is we need to suppress that from the pigment actually being able to be produced. With the exfoliators, you need to remove the damage that's already there, slough it off with good chemical exfoliants. Mechanical exfoliation is lovely in between things like peels, but it's something that, you know, if you're actively treating the condition itself, needs to be done fairly, you know, with a regular structure to it. So it would be kind of like regular chemical peels, and then you would carry on. You need to carry on doing that. What is important to know about hyperpigmentation is that once you have cleared the pigment in your skin, essentially, you need to keep on top of it all. You need to keep protecting it, keep exfoliating it on a long-term basis, because once it's gone, it will and can come back. Particularly, you know, you'll notice that you'll go out for a day in the sunshine, and you'll notice that I've got lots of freckles, and I noticed that actually a day out in the sun, my freckles seem more prominent than much more easily seen. And this is kind of like, that's the norm. So what you don't want is to have done all of that hard work in treating the pigmentation and then damaging it all again in the sun. So treatment serums, exfoliate, SPF, those are the key things. Has anybody got any questions? I've kind of whizzed through that quite quickly. Michelle, can we do anything to get rid of hyperpigmentation? Yes, as I've just explained, 3 key factors to getting rid of it. But you must keep that, that can be done over, a relatively decent period of time, or it can be done over quite a short space of time, just 3 to 4 months. But the key is that you carry it on and just keep working to actually, I'm losing my voice, sorry, to actually maintain those results themselves as well. So it's important then not to go straight back out in the sunshine and try and go and get a nice tan, because as I've said, a tan isn't actually healthy at all. It is in fact your skin's natural defense mechanism to protect the damage to the DNA cells. So so I've whizzed through that really, really quickly. Like I said, if you've got any questions about hyperpigmentation, if you think that's what you might have and you want to talk it through with me, you're more than welcome. I can go through it with you and we can try and figure out what you've got. Of course, if that is something that you want to treat, some people are really not too fazed by the pigmentation changes. I think melasma tends to be quite a key issue because it can be quite pronounced. And similarly with post-inflammatory hyperpigmentation as well, so from your scars and your acne spots and things like that, the pigmentation that comes along with that can also be quite quite damaging. That can be quite upsetting to have that kind of hyperpigmentation that people then may want to treat. But there are options. There are lower grade, longer term options, and more aggressive, faster results driven medical grade prescription only products as well. So I'll be happy to talk you through any of those options or answer any questions.